Thank you, Jonathan. A stunning health announcement out of Hollywood last week. Award-winning actress Julia Dreyfus announced she had breast cancer. And about 1 in 8 women had a chance of having invasive breast cancer during their lives. More than 250,000 women will be diagnosed with a new case of breast cancer this year. It's the second leading cause of death in women. But with early detection, it can be defeated, and there's no better time to talk about breast cancer and the signs to help spot it than today, because it's the start of Breast Cancer Awareness Month. And joining us now is Dr. Lauren Cornell from the Mayo Clinic. Good morning and welcome.
Good morning. Yeah, thanks for having me.
Yeah, so first let's talk about how can you identify whether or not you have breast cancer?
Yeah, so I think that for women out in the community, it can be really confusing to know when they should start, screening or start looking out for breast cancer signs and symptoms. There's a lot of different expert guidelines out there about when to start and how frequently you should be screening. But really, I think one thing that all of the experts can agree on is that there needs to be some degree of individualizing a patient's screening recommendations.
Okay.
Patients should really have an informed discussion with their providers about their family history of breast cancer, their breast density, which is often reported on their mammogram reports, as well as any personal history of breast biopsies that may put them at increased risk. But you will see a lot of different recommendations out there, but having that informed discussion with your provider is really important because they may make different recommendations based on your risk.
If there's a history in your family of your mother or your grandmother having breast cancer, does that mean that you should get a mammogram earlier than others?
It may. It very well may. It's hard to say, without knowing a detailed family history, but we are able to now use standardized or well-validated models to actually calculate any individual woman's lifetime risk of breast cancer, and that helps guide our recommendations as far as whether we just do traditional mammography, a 2D mammogram, or whether we may recommend supplemental screening in addition to that mammogram. We may recommend 3D mammograms or something called tomosynthesis. Or if your lifetime risk exceeds 20 to 25%, then we may even recommend something like an MRI in addition to traditional mammography.
Wow. So for a woman at home, are there certain things that she should automatically do as far as checking her breast to make sure that she's not in those beginning stages?
Yeah, that's a great question. And again, there is some controversy over whether women should be doing self-breast exams. I would say at the Mayo Clinic, it's our consensus and kind of position that women should be familiar with their breast tissue so that you can really appreciate when there is a change. So I think doing self-breast exams are important. And for women who are still menstruating, to do that exam during the same time every month in their menstrual cycle, because the breast tissue just does change during the menstrual cycle. But then when you do appreciate a change, contacting your provider and going in for an exam is important.
Now, do studies say that there is a particular age where you need to start talking to your physician about doing the breast check?
Again, there is, some discrepancies in what the experts would recommend, but I would say it's never too early. Certainly, I think age 40 is kind of when people start thinking about it generally, but talking about it earlier, especially if you have a family history of breast cancer, is always a good idea to know how to do a good breast exam and make sure you're covering, everything.
And my final question then, what's good for women to do right now as far as their breast health?
So for a woman at average risk, let's say, of breast cancer, it's the Mayo Clinic's position and consensus that for an average woman, again, we would want that individualized discussion about your risk, but for an average woman, we would start mammograms, 2D mammograms at age 40, and then if that's normal, continue on an annual basis. But again, individualizing that is the important thing.
All right, thank you, Dr. Cornell, for talking with us.